Hi, this is Talia MK at Health 2.0 Conference, Dubai Winter 2022, and I have with me Mr. Zeeshan Ahmed, founder and chief executive from CosmoTrace. That's a very mixture of two names, a very unique name, and he has also been awarded, I believe, for outstanding leadership. Thank you for being here. Congratulations for being here. And his work is provide consulting services to pharma companies focused on product serialization and traceability. That is, in easy words, you have that one Skittles box, that one had a serial number. He is responsible for making sure that you have the unique Skittles which you're eating. That's an easy word. So please tell us about you and your company and how it all started.
Right. Hi, everyone. So I'm Zeeshan Ahmed. I'm the founder and chief executive of CosmoTrace. So we are headquartered in London, and we have offices in Dubai and India. So like you said, rightly said, we provide consulting and services very specific to product serialization. And to explain it in a very layman terms, it is about verifying the product, right? And we're very focused on pharma serialization and traceability, right? Now, the whole idea behind this is the patients getting the legitimate medicine, right? Because what we see and what we have been seeing in a lot of countries is fake medicines, right? And we don't want patients to get fake medicines. Yeah, so a few years back, I was working for a company which provided software for serialization, right? And obviously, when I started working with it, I got really interested because it was about saving patients' lives, ensuring the right product is reaching the patients across the globe, right? So when I was working with working with the software company, I realized there are many software providers out there who are providing software. But I was also seeing a lot of pharma companies struggling to implement and meet the compliance deadlines. So definitely found a gap there. So I thought I'll get into this in my own way, kind of help pharma companies and eventually help the patients to get the right medicines, to get the legitimate medicines.
So basically, you work as a middleman when it comes to medicine being produced. You get it, and then you provide it with proper serialization and traceable medicines to the pharmacies. And do you provide it to the clinics or hospitals, or is your work is only the middleman?
So again, we work as consulting, right? So think of us as an IT consulting company, very focused on serialization, right? So given an example, a pharma company wants to serialize, right? And they would need a system. They would need people to implement the system, right? That's where we come in. We come in, advise them on the regulations. Like for example, UAE has just gone live a couple of days ago with UAE, for example, has gone live a couple of days ago with serialization regulation, right? So any medicine which is prescribed is coming into UAE has to be serialized, right? And what we do is we help all these pharma companies, distributors, pharmacies to ensure they're implementing a system and then they're sending the data to the government authorities. So we play as a consulting and implementation provider. That's how we help pharma companies.
So you're consulting not only in India and Middle East. Your company is providing services all over the world, or and if yes, how anybody can reach out to you, and what are the what are the aspects that are like must have by the company who wants to attain your services?
Absolutely. So we are providing services. Our headquarters is in London. So we are providing services across Europe, right? US. Again, Europe was more matured. They have implemented serialization already, so they are there. So we have customers, quite a few customers we working in Europe. Then we are moved to India as well, providing services there, and now in UAE, right? So we see a lot of companies want to get compliant with the serialization and traceability regulation. And that's what we're helping the customers with. So any pharma company or a distributor thinks they need help to implement serialization, be compliant with the regional regulations, then they should contact us, and we will be able to help them, consult them, implement their systems, provide operational support. So
How do you see the counterfeit medicines getting eradicated from the globe? How do you see it, and how does your company help all of this companies?
Right. Again, I see. I think it is a great initiative by a lot of countries that's being taken now, and all these countries. So for Europe, has already done it. Now UAE, they're taking the initiative to say any medicine that is in the country, it's going to patient, has to be serialized. So they should have a 2D barcode, and then when it gets to the pharmacy, before dispensing it, pharmacy needs to scan it to check if it is genuine or not. So I think that's a great initiative wherein, pharma companies cannot sell products if they're not serialized. So that makes it airtight, right? So then that reduces the chance of products coming into the market which are not genuine, which are counterfeit. So I think that's a great initiative. A lot of countries have taken it. Europe has already done it. US has the full compliance is next year, 2023, and then Dubai is doing it. Saudi has done it. So a lot of countries are doing it. So that's a great initiative, and I really appreciate that. And as a company, to your next question, we are part of this, and we want to play that small role in ensuring patients get the medicines they deserve, and somehow in our own way save and protect patients' lives. And with our services, we help them.
So I think so this is something very important. Everybody is focusing on traceability, or to be sure they have the right product. Do you guys face any backlash or any difficulties when it comes to providing these services?
Yes, we do. What happens is, because this is not a good to have, it is a mandate regulation from the countries, right? Now, there are many pharma companies or distributors which are very small, right? And this, the extra initiative comes as an overhead, right? So, a lot of
More responsibility. It's
yes,
one more responsibility.
one more responsibility, and they're like, yeah, it's all good to serialize, but then we haven't got a business that can again afford an extra cost, and that's where we hear a lot of,
Convincing you have to.
yeah, we hear a lot of distributors or smaller companies saying, hey, that's an additional cost. How are we going to manage it? But then that's where we also help, figuring out a solution for them which is within their budget, and helping them either with a smaller solution or some kind of workaround, and that's what we do with our distributors and pharmaceutical companies.
Thank you so much for your time, and I would like to know that being at Health 2.0 conference in Dubai and coming across so many different professionals of internet marketing, how does it feel? How does learning and networking experience has been? And if I want to avail your services, how can we contact you?
So firstly, it's been an amazing conference. I was able to meet a lot of people, a lot of visionaries, a lot of leaders, have a good networking session with them. So definitely recommend it. And in terms of availing our services, our company is CosmoTrace.com. So you can visit our website, you can email us at info@cosmotrace.com, and just contact us on the website as well. So more than happy to help.
So at the end, I would say if you have a traceable and authentic medicine, then that means you're in a safe hand, and he is the one making sure you get those medicines in a right way and a right manner. So thank you so much. A lot of growth to you and your company. I hope to see you next year as well. And this is Talia MK signing off.